It is one thing to wear pink this month, it's another thing to take action. As we do mark Breast Cancer Awareness Month, a breakthrough screening system has arrived in Dubai, making early detection faster and smarter. So this hour, we're finding out how HealthBay Vitalia's new system, overseen by award-winning radiologist Dr. Amrita Kumar, is helping doctors catch what traditional scans might miss. Dr. Amrita, thank you so much for being with us today. I know how busy October is for you, so thank you for being in studio. How are you?
I'm very well, Helen. Thank you so much for inviting me today.
We're going to talk tech, we're going to talk science, but before we get to this new bit of kit that you're lucky enough to have your hands on, why is this an area of medicine that you wanted to focus on? Can I ask you, I don't know if that's a personal question, but I always find it really fascinating to understand why experts are drawn to particular areas.
No, thank you very much. And it's a very important question, Helen. I think for me personally, breast cancer is the number one cancer in women in UAE and worldwide. And the good thing is that the research shows that the earlier we catch it, the more easier it is to treat. And I think when I was a medical student and I was looking at the different areas that I wanted to specialize in, the fact that we can get on top of it, treat it, and our patients go back to living their best quality of life, that drew me the most.
That's interesting because it's like, I'm very conscious of talking to my children about how preventable cancer is. And, I unfortunately did lose a friend last year to cancer, but I don't want that to be my children's only takeaway. Because when actually I sit down and go, yes, that happened, but also here are 5 people that you know that are in our lives here in Dubai who have had breast cancer. And as you see, are at the beach and are showing up as, working women and mums. It's really important that there is a powerful message that prevention can literally save lives. And that I'm very grateful that I've had friends that has been the case. So thank you for being with us today and raising awareness. Let's talk tech. Tell us a little bit about this new Hologic 3D system. How does it differ from, I guess, what many of us as women who've been along and had breast exams, how does it differ from that standard 2D mammogram that many of us are used to, Doctor?
So thank you for that. Now, actually, that's the latest technologies in mammograms. They've been coming along for the last maybe few years, but what we've seen is because cancer is coming in younger and younger ladies, they have, as you rightly mentioned, dense breasts. Dense breasts is really the relationship of how much fatty tissue compared to breast tissue every lady has. And just to give an example, breast density is something in certain countries like America, every lady knows what their particular breast density is.
What do you mean, like a number or a profile? Or
yes, there is an objective measure for your breast density, and why that's important is because the highest breast density, the higher it is, the slightly higher your risk of breast cancer. And to give you an example, the best way I describe it is if you have very dense breasts, when we're looking at the mammogram, it's like looking for a polar bear in a snowstorm. You just won't see it, whereas someone who has less breast tissue, even the smallest half a centimeter finding we can pick up on the breast. So there is a differentiator automatically depending on the breast density, which is why the 3D Hologic system, not only is it where you take multiple pictures within the same run of the breast, it also looks and identifies and differentiates between dense breast tissue and something that could be suspicious or cancerous.
Of course, AI is playing a role. It's 2025. Can you explain how AI actually assists in that detection process? What is it, I guess, seeing that the human eye might miss?
No, thank you for that. We are one of the first centers to have the Hologic Genius AI, and it has 2 functions. AI is like a second pair of eyes. So when you've got multiple mammograms and you're looking through each patient's particular breast density, the AI can first triage and prioritize the abnormal mammograms ahead of the normals. Wow. So that you're a little bit faster. If someone has something, you can expedite it. Secondly, within a particular mammogram, the AI can pick up actual extra cancers which human readers may not be able to pick up. So I think research to date shows anywhere between 8% to 20% cancers being detected over and above the first human reader.
Would you mind kind of demystifying a little bit about what an appointment would look like? And I guess even in comparison to the mammogram. You know, if someone was to come to clinic and make an appointment with you, Dr. Amrita, and say, I heard you and Helen talking about this new bit of technology. How might it that experience kind of unfold if you are booking in for a detection?
Lovely. So obviously I work at HealthBay Vitalia in Dubai. So when you come in, usually once you're checked in, the first thing you do is have a mammogram. Typically a mammogram appointment will be 10 to 15 minutes. That includes getting changed, coming into the room, and the positioning. Now, historically, ladies have found mammograms uncomfortable. It can range. It can range from discomfort to pain in some cases.
Can I just say, I'm 43 now, so I've had 3 years of mammograms. I personally haven't had any discomfort. Now, I'm saying that because I don't want that to be a deterrent to anyone listening, because not everyone is going to be able to come in and try this bit of kit, and I know that's a big selling point, this idea of avoiding the discomfort. But for anyone who is booking in perhaps for their first mammogram this October, you might not have discomfort, because I certainly didn't. I just want to say that because I don't want people to be afraid of pain and that for them to be a reason to not get a mammogram. However, continue.
I completely agree with you, Helen. I've had mammograms as well, and for me it's absolutely fine. The reality is, even with our newest Hologic machine, that actually has got a curved plate, so it's a little bit more comfortable.
So that kind of it's got a curved kind of compression space, is that right?
Absolutely.
Okay.
So it makes it a little bit more comfortable in the event certain people experience a little bit of discomfort.
And is it a quicker appointment than a traditional mammogram? Is it longer because it's more involved? What does that look like?
Normally it's the same time in terms of once the plates are applied and the pictures are taken. It's just that we get a lot more images for that same compression that would have happened in a normal 2D mammogram, and that extra information helps with interpretation. It's shown to detect more cancers. The AI component obviously adds further value to it.
I've heard up to 65% better detection, so we're going to be getting into this as well and answering the questions that are coming in on 4001. We haven't even touched on the ideal age and frequency of women to start getting mammograms. We're also going to talk about risk factors as well. No name on this message saying, I had a mammogram last year, it came back normal. Do I need to go again this year? Great question. All of this and more up for discussion. We've got Dr. Amrita Kumar with us today, consultant interventional breast radiologist and the AI clinical lead at HealthBay Vitalia. We're talking about their new bit of kit. If you want to send me the word health, I'd be very happy to send you a bit more information so you can do some reading, make an appointment in your own time. But great opportunity to ask any questions live on the show. Artificial intelligence isn't just transforming business or transport. It is saving lives, and this Breast Cancer Awareness Month, Dubai has become one of the first places in the region to offer AI-assisted 3D breast screening at HealthBay Vitalia. This tech isn't just promising clearer images and quicker results, but also fewer false alarms. So what does that mean for women here in the region? Dr. Amrita Kumar is with us today to answer my questions and yours. Doctor, you've worked and led AI groups internationally, and I wondered about privacy, about safeguarding, and how do you ensure that technology enhances and not replaces the all-important human element in care?
Thank you for that, Helen. I think it's very important to focus on the governance side of things and be reassured that there is a stringent AI governance plan, whether it's to do with the privacy or the data side of things, so that no data, everything is kept within hospital settings. But the second point is that AI is used by the clinicians to augment their work and not replace it. So at all points, a mammogram is always looked at with specialists. But when you have a second pair of eyes, we are seeing more and more extra cancer cases, especially in dense breasts, being detected with the radiologist and AI working together in a synergistic way.
You mentioned earlier about the importance, and actually in some countries that a lot of women will know kind of the density grading of their breast. Would you mind explaining, you said there's kind of 4 categories as such. Could you break that down for us?
So in a country like US, it is mandated that you do inform ladies about their dense breast, and why that's very important is because the higher the breast dense, you have a relative increase in breast cancer to do with the breast density. So the measurements that we use is an international objective measure. It's the BIRADS breast density, where we have it from A to D. A being slightly more skewed towards predominantly fatty breasts. B when there's a mixture of fatty and dense and breast tissue. C and D are your increased breast tissue, and D is essentially, as I described, looking for a polar bear in a snowstorm because you can't see anything unless it's large enough to start distorting the tissue, which is when we follow it up with ultrasound. But it's where in our standardized reports we always mention the breast density so ladies know what that means, not to cause them anxiety, but so that they're aware of where they are placed.
Thank you for that. Appreciate it. Anonymous message here for you, doctor, saying, I had a lump in October last year. I was referred. It was a cyst. Had a mammogram, ultrasound, all good. But last week I did see a small lump on my left side. Last time it was right. When putting on my bra, it's small. It moves slightly, moves up and down with the tissue when I raise and lower my arm. When lying down, it seems to sit between my ribs. I know I need to call the doctor, but I don't want to waste their time. The mammogram did show dense tissue. I'm 42, so likely perimenopause is throwing hormones into the mix. Any advice?
No, thank you for that. And it's really good that you're aware and regularly self-examining. So really well done for that. And the fact is, if you have noticed a lump and it has been a significant period of time, I mean, if it's been a year, absolutely go and see your specialist. And screening is usually mandated annually anyway. So even having that repeat mammogram, which adds further information, if there is a lump there, an ultrasound will be indicated as well. And then the clinician who's looking after you can advise any supplemental imaging or procedures that need doing.
Can we talk about risk factors again? I know you mentioned the huge genetic component, but what about lifestyle factors? And I guess now that you've got the power of the microphone, Dr. Amrita Kumar, what message would you give to women listening who want to ultimately preserve good breast health and general health?
So screening is really about a balance of the benefits versus risks. So we know the benefits in terms of finding cancers early. Now, when it comes to knowing your different risks, there is no one thing that's been shown to cause breast cancer. Now, if you have a genetic component, that's still a very small proportion of the population. Yes, there are supplemental imaging with breast MRI that we can do, but there is a range of personal risk factors to be aware of. And actually, a lot of them are generalizable to cardiac health, to diabetes care, to other cancers. Sleeping well, exercising at least 30 minutes 3 times a week, with a mixture of muscle, weight bearing, and cardiovascular exercises. Eating vegetables. Now, I know I'm not the best person who eats 5 different types of vegetables, but including that to increase the fiber in your diet, these are basic mechanisms. Moderating alcohol intake, moderating the amount of salt and sugars you take, being careful of the sun and wearing sun protection factor 50 wherever you go. And again, it differs. There's no right and wrong. It's just balancing everything. But one of the things that we do is offer that personalized risk scoring to see exactly if you're still within the low-risk population baseline or if any other steps need to be considered.
And looking ahead, how do you see technology and, of course, AI in particular evolving in the health space, but, specifically your area of interest, breast imaging? Could we one day predict risk before cancer even forms? Where could this go?
I think for me, it's that shift towards personalized breast care. I mean, normally people worry because they wait to go to the specialist once they have an actual symptom or a lump. The way I look at it, we're shifting more towards personalized care where we are looking after each other and going in and getting the appropriate checks to make sure that everything is okay, not necessarily going to find a problem. And I think AI really helps because it helps us aggregate all the different data measures unique to that person, whether it is breast density, whether it is family history, whether it is that there are lifestyle issues or certain tablets they may be taking that may be predisposing, so that they have an idea of where their risk lies and how to be informed about it and take the next appropriate step.
Now, we have had something of an omission over this last hour. We've been talking about women exclusively. What about men coming in for breast cancer screening? We've had guests on the show who've been open and generous enough to talk about how they were blindsided as men to have a breast cancer diagnosis. How could this technology be helping all members of society?
Absolutely, it helps with men as well, and men can get breast cancer as well. Now, normally the advice we always give is to do regular examination, monthly self-checks, and if ever there is any concern because there is a lump or something sometimes you can just have a little bit of extra tissue or pain as a symptom, to always go to your specialist and where appropriate, they will do ultrasound and mammogram on men as well.
And what about self-checks for women? Is there a time of the month, a day of the menstrual cycle when you're going to get the most accurate read? And I guess, are you able to give us a quick guide on self-check, Dr. Amrita?
So what I would say is everybody's breasts are different. It can be the texture, it can be shape, size, and it can be how it responds to a regular or irregular monthly cycle. The important thing is to know what your breasts feel like. And all of us, majority of us, have some sort of cyclical pattern. I know if I speak for myself, the easiest time to examine my breasts are the week after my periods, because they're generally most settled. There's no symptoms ranging from either sensitivity, pain, or hardness that can be quite volatile over those particular timelines.
But you need to know you're normal.
Absolutely. Knowing what is normal for you, because all breasts are lumpy. Knowing what's normal for you is the first step.
Thank you so much for coming in. You must be really excited to have this new bit of kit there at HealthBay. You feeling like the most popular girl at school? Everyone's coming to see it.
I think we're very fortunate that we have this excellent technology that is better at picking up cancers, and that we can offer this to everybody.
You've come from the UK, been in the UAE for a year now, and I know globally recommendations differ. But to your mind, what is the ideal age and frequency for women to begin regular mammograms?
So we are seeing breast cancer in younger and younger ladies. So the protocol that we use and advise for regular screening is to have annual mammograms from the age of 40.
Now in the UK, it's later, and there are, obviously reasons for that in terms of stress and strain on healthcare providers and services. But I would imagine that's a decade difference from 40 to 50. And I would imagine the types of cancers that are being detected at different ages must differ as well.
Absolutely. Now, we have to bear in mind that the UK model is based on a population-based, cost-effective risk ratio, primarily on very historical data. So I think that will be reviewed in due course in the years to come. But I think when I get asked this question, I always talk about the fact that it's a balance of your personalized risk, and that's some personal risk factors, as well as your breast density, as well as your family risk of breast cancer, which is why from the age of 40, I would always advise to get your baseline mammograms and check it every year.
When you're talking about risk factors and family history, is it a case of, my mum had breast cancer, my aunt, my great aunt, my grandmother, when we think about what is a measurable risk to us as individuals, what would you be taking seriously, doctor?
So the way we look at risk in breast cancer is that the normal risk is a population-based risk, which is referred to as low risk. That's with it being that breast cancer is the number one cancer in ladies. The intermediate risk requires you to have certain other personal risk factors alongside potentially a family history. High risk tends to be usually a genetic component. We have quite a list of different genes, the most famous of which are obviously BRCA1 and 2. And that usually means that you have possibly 1 to 3 first-degree relatives with breast or ovarian cancer. So I think it's very important to know where you lie in that risk stratification, even if it's arbitrary. So one of the things we do is at the point of your first mammogram, we calculate something called the IBIS score, and that takes into account multiple personal risk factors as well as family risk factor and breast density, so that is it just population level, is it intermediate, or is it high? And it's not so that we cause anxiety, it's just so that you are fully aware and informed, and then therefore know if you need to do any supplemental breast imaging, that you do definitely need annual checks, and just to be assured that you have that sort of knowledge and collaboration with the clinician who's looking after your breast care health.
To my mind, it's just all information, really. But if I went to a hospital last year and then I came to you, for example, do you then take? Sorry, this is not such a boring question. Would you then take the mammograms from another clinic, or would you create your own kind of baseline with a mammogram if you've got a patient for the first time, doctor?
Where possible, we'd always ask for the previous mammogram, only because, especially when you have dense breasts, it allows us to just compare and make sure that we're not overcalling anything, and we can also spot any subtle changes.
Message here, no name, and it's absolutely fine to be anonymous, saying, I had a mammogram last year, all came back fine. Do I still need to go again this year? We don't know how old this listener is, but you're recommending annual.
Absolutely. I mean, it's great news that the mammogram was normal, and you have to be aware that 90 to 95% of mammograms are normal in screening, but it's very important that you do follow the recommendations, which is annually from the age of 40.
I wanted to ask you a little bit about coming back to this bit of kit, the 3D screening. So what happens next? Let's say someone comes in and there is something that you flag as an expert radiologist. Would you then go through the normal process, which might be an ultrasound or an MRI or a biopsy, but it just means, as you said, you might be alerted to it sooner?
Absolutely. So normally when you come to us for screening, the mammogram 90 to 95% of the time is normal. For another maybe 5 to 10%, we may do some extra mammogram images because the tissue may have fallen on top of another bit of tissue that just requires spreading, and we'll be able to alleviate and call it normal after those extra. Now, if there is a finding on it, we will follow it up with a breast ultrasound as a first instance to see if there is a solid or liquid lump there. Now, in the event on ultrasound something is suspicious, you may need a biopsy under ultrasound or potentially sometimes a mammogram.
We've had a message here saying, is it possible to have a mammogram when you've got implants? Good question. I heard that apparently 1 in 3 women in Dubai have breast implants. I'm like, wow, that's a mighty high number. No judgment. Quite fancy some myself. Can you get a mammogram if you've got breast implants?
Absolutely. I think it's a very important myth to dispel. Mammograms and implants absolutely fine together. We do a few extra views just to focus in on the tissue sitting in front of the implant, but it's absolutely fine to do.
Perfect, because I think that's the big fear of a lot of people is going, well, you're going to, squish my breasts. They're going to be sandwiched in the mammogram and you're going to put my implants. Not the case. Fear not. As I said, if you want to send me the word health, I will send you the details of Dr. Amrita Kumar, who's joining us in studio from HealthBay Vitalia. We're going to be delving into that technology. We've also had a message asking about a lump that someone has found. And I think it's really important to talk a little bit about the anxiety that a lot of people have or hesitancy around screening. So we're here to put your minds at ease. 4001 with the word health if you want more information, or indeed you've got a question. We are talking health through until 3.